Trauma may predispose victim to a natural disease or may aggravate an already existing natural disease. Death may be immediate, like MI or remote infection or a neoplasia. Trauma and aneurysm. Trauma can be both the formation of aneurysm as well as the rupture of an already existing aneurysm, leg rupture of a large fragile aneurysm on a circle of Willis by substantial head injury, sometimes seen in a shaken baby syndrome. Traumatic aneurysm are mostly falls occurred by a through and through rent in a vessel wall, lap belt aorta. Through aneurysm, all the three tunica layers are involved. May also form rarely due to partial traumatic disruption of the vessel wall. Trauma and cardiac complication. Cardiac complications of the chest trauma. Cardiac complications of chest trauma, arrhythmia, myocardial rupture, myocardial contusion, valvular avulsion, and MI rarely. Medical legal question also raised regarding timing of cardiac complication in relation to the trauma. Many traumatic incident, example car crashes, most often affect person with the cardiac risk factors. Queries arises, did a cardiac complication, arrhythmia, MI occur first during the accident or did it occur after the trauma accident? Trauma and neoplasia. Relationship between trauma and neoplasia is given by several criteria. Most popular of which are having postdays. Each must be fulfilled before trauma and may be lethal, said to have caused malignant disease. When the victim becomes visible for compensation from the person inflicting trauma. Ewing postulate. First postulated by the US pathologist James Ewing in 1930. This is better known for Ewing's sarcoma. Authenticity and adequacy of trauma must be shown. Trauma must be sufficient to cause tissue disruption. Previous integrity of the wounded part. The part developing the malignant disease must have been normal prior to trauma. Original trauma. Tumor must originate on the part of the body that sustained the injury. The time period after trauma, the tumor must develop within a reasonable amount of time after sustaining the trauma. The period is usually taken as 3 weeks to 3 years after the injury. Positive diagnosis. There must be a positive pathological diagnosis of the presence and the nature of the tumor. Biopsies in the living and autopsies in the dead are mandatory. Furthermore, the tumor must be of the histological type as the cells that were disrupted. Some general observation. Number of trauma incidents. Single trauma incidence is generally agreed that a single trauma never produces a malignant trauma in a previously normal tissue. Repeated minor trauma irritation is most likely to cause neoplasia by making cellular proliferation and regeneration under regular repair. Continual leg cancer of skin adjacent to chronic osteomyelitis sinus that has drained for a number of years. Skin cancer developed in burn scars, attracting attention, sometimes attract nearly attention of the victim to a previously existing non-tumor. Case study: a 50-year-old woman, apparently healthy woman, suffered one trauma of the left breast in a minor vehicular accident. On coming home, when she self-examined her breast, she found a mass which later turned to a tumor. She sued vehicle owner for compensation but could not bid. As a tumor cannot develop within hours of trauma, it merely attracted her attention to previously existing tumor. Accelerating growth and metastasis of tumor. Pre-existing tumor trauma causes it spread more likely to disseminating tumor cell. Trauma and neurological diseases. Head trauma may result in dementia, expressive language, mental disorder, mental retardation, personality changes, post-traumatic stress disorder, traumatic neurosis, post-traumatic neurosis. Railway spine is a form of post-traumatic stress disorder. Next is a trauma and pregnancy. Trauma and pregnancy. Happy Independence Day. Thank you. Malayam Shikala Sasya Shamala Vande Bharat. Thank you.